Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Thursday, September 10th. It is 5 p.m. So, recent research from the United Kingdom, which examined nearly 11,000 COVID 19 related deaths, found that men are nearly twice as likely to die of coronavirus than women. Now, data from China suggests the disparity may be even more pronounced. Their study showed men were 2.4 times more likely to die of the disease than women. Now, a study just published offers a potential reason for this trend. Women seem to develop a stronger T cell response to the virus than men do. And we've talked about the immune response, that maybe the antibodies are not the key factor in providing true immunity or enough of immunity in and of itself, that the T cells may be the determining factor that really separates one from the other. And in this case, it's seeming to be the case. Now, T cells are a type of white blood cell that help our immune system identify and destroy an invading virus. Now, they can also remember and reattack the virus should it return, and those are the memory T cells, very similar to what antibodies would do, which come from the B cells. The B cells are from another type of white blood cell. Now, according to the new research, women develop more T cells in response to COVID-19 compared to men, but in addition, the strength of the men's T cell responses to the virus, meaning how many of the protective proteins they develop and how quickly, seems to deteriorate with age. So older men with poorer T cell responses developed more severe cases of COVID-19, according to the study. Now, these findings brought up an interesting point. Should male and female COVID patients get or require different treatments? Now, would men need interventions to elevate their T cell immune response to make it equal to that of women, for example? Now, the study showed that a woman's age did not affect the robustness of her T cell response, if that's a word, but sometimes seemed to respond almost a little too aggressively. So both male and female patients had elevated levels of cytokines, and we've talked about that before, the proteins produced by the white blood cells to further activate the immune response, so relative to healthy individuals not infected with COVID-19. Now, the study found that when cytokine levels were elevated, women were more likely to become very sick. This excess of cytokines, known as cytokine storm, can cause damage to healthy tissue and actually worsen the situation. Now, the scientists suggested that men may need 3 doses of any future vaccine compared to women only needing 2 to mount a proper response. Again, whereas women might benefit from treatments that dampen the immune system ahead of the cytokine storm. So there's a little bit of a disparity of who might need what. So in order to create better immunity, they're looking at possibly vaccinating men 3 times instead of 2, and for women trying to possibly cut down the immune response a little bit to prevent that cytokine storm, which is, again, more likely happening in women. Some scientists believe that behavioral factors may also make men around the world more vulnerable to severe cases of COVID-19, specifically pointing to smokers. In China, more than 50% of men smoke, while less than 3% of women do. And in Italy, 7 million men smoke compared to 4.5 million women. So similar to statistics are happening in other countries. They're also talking about heart disease as another possible indicator of a disparity between men and women. So it's very interesting to look at these factors because, again, the men response, if you're looking at China and you're saying, well, they're more likely to be smokers, well, then smokers potentially are more likely to have a worse response to the virus. And we've talked about that before, how the particles and all the different pollution of sorts in your lungs can impair your body's ability to fight a virus. So just things to consider, things to look at, what may actually come to pass in the future in coming months as they look to see if this disparity continues, and again, how to better treat both sexes appropriately based on their response to the virus. Again, I find it very fascinating. Again, it's a scary time. It's a scary thing that's going on, but I think the scientists are really making tons of headway figuring out some of these different things so that we all have a better chance of getting through any infection we may develop. So on that note, I hope you guys are having an awesome Thursday, and I will see you again tomorrow for another Live in 5.